Hey guys, I'm Dr. Jayavrat and welcome back to my YouTube channel. Today we'll be discussing about those 5 things you should know before you start your braces treatment. So before we talk about that, hit that subscribe button and also like the video when you're done watching it. So let's dive into it. The first thing which you should know before you start a treatment is the duration of the treatment. So a lot of people ask how much time will it actually take for my treatment. So usually typically it will take from 1.5 to 2 years for any average orthodontic treatment. It might be a little less if your treatment is very straightforward, and it also might take more than 2 years if your treatment is a little complicated one, but on an average it will take 1.5 to 2 years. Second thing is visits. So a lot of people ask that how many times will I have to come in those 1.5 to 2 years? How frequently will I have to come? Like, is it once a week, once in 1 month, once in 3 months? So on an average, once in 1 month is a good time for you to come to the orthodontist. The reason for that is because when we are tightening your braces, the effect of that tightening will last for 1 month. So now after 1 month you will start to feel normal, or it will start to become loose. So we'll have to just activate it again after 1 month. So once a month is a good time for you to visit your orthodontist. Third point is pain. How much pain will I have during the treatment? So on an average, or usually when we tighten the wires and when we tighten your braces, you might experience mild to moderate amount of pain for the first 2 to 3 days. After that pain will subside and you will start to feel better, but still you will have to have a soft diet and not anything which is very hard, so that you can bite easily. But yeah, when we tighten the wires, you might have pain for 2 to 3 days, then it will subside down. Next is tooth removal. So a lot of people actually need tooth removal because they have complaints of forwardly placed teeth, and their teeth are proclined, or their teeth are way ahead than their position where they should be. So since you have to push the teeth back, or we need space to align the teeth, so in that case, if we do not extract the teeth, imagine that if this is a circumference and you have lot of teeth here, crowded, and if I need to fit these teeth in a line, in a straight line, so I will have to take out this one teeth and take out this one teeth so that they can fit in easily. Otherwise, if I try to fit the same teeth without taking it out, so it will go out. If this is like a little bit of understanding regarding the circumference, if we reduce one tooth, our total circumference will get reduced, so we will be able to pull the teeth back. But if we do not extract any teeth and if we still try to do the treatment, you might end up with teeth coming more forward. So that is one reason why we need to extract the teeth. And people also ask that, is there any problem if we extract the teeth? So there is no problem. Like, some people even think, like, there is a big misconception that if we remove the upper teeth, our vision gets affected. There is nothing and no scientific relation, or it has never ever happened that when the upper teeth is extracted, it is completely unrelated to the vision. So you should never think in that way. You might just feel discomfort for 3 to 4 days when we remove the tooth, and that also is a painless procedure because we do it under local anesthetic. So yes, some people, and only some people, depending on how your condition is, might need an extraction, and some people even don't need extraction, so no worries. So tooth removal. And lastly, what all can I eat, what can I not eat, and how should my diet be? So you cannot eat anything which is very hard, like candies and very sticky food, such as those chewy and sticky chocolates, those butter toffees and all. These things are suggested to not be consumed because they get stuck between the brackets and wires and they can cause decay at a later date. So first thing is that. Second thing is hard candies and hard things, chocolate chakki and those matris and all those things are not permitted, because when you bite, after all you've stuck the bracket with the help of a glue to the tooth. So if you bite anything hard, there is a good chance that it might break off. So you will have to again run to the orthodontist, and then they will have to fix it back. So it is not advised that you eat which is something which is very hard nor sticky. And also, in case if you consume a lot of soft drinks, you have to rinse after that. So these are the precautions which you should take for before orthodontic treatment, and these are the 5 things which you should know about orthodontic treatment. Now there was one more 6th thing about which everyone wants to know: what is the cost of orthodontic treatment? So I will discuss about that in the next vlog or the next video. And do like the video, guys, do like the video. Thank you so much for watching, and I'll see you around. Bye bye.